I've been asked to say some words about my father, Karl Ekbom. My father, Karl Ekbom, was born in Gothenburg in 1907. He got his medical education at the Karolinska Institute in Stockholm and became resident of neurology at the Serafimer Hospital, also in Stockholm, in the late 30s. The Serafimer Hospital contained at that time the only specialized department of neurology in the whole of Sweden. My father served at the outpatient department that you can see here on the right-hand side. My father was a pure clinician, he was a careful listener and deeply interested in the complaints of his patients. Headaches, migraine, pain and sensory disturbances were among his major clinical fields of interest. In 1943, he came across a number of patients with a kind of severe paresthesia in their lower limbs, which he had never heard of before. The patients complained about creeping sensations and anxiety in their legs, but they got better when they were treated with vasodilating agents. He decided to examine these symptoms in more detail and was soon able to collect a number of patients having a very distinct disorder that evidently had not been described before. Searching for previous literature was not very easy in the early 40s because of the Second World War. International contacts were restricted, and I can mention one example of his difficulties to read on possible similar previous cases. A copy of a particular article published in a Canadian journal had even to be required with the help of the British Council. Nevertheless, my father published a preliminary paper in 1944 in Acta Medica Scandinavica, and he first named the disease irritable legs, describing 8 personal cases. But when he collected more cases, he changed the name to restless legs. In 1945, he was able to present his academic dissertation. It was written as a monograph. 2 forms of the disease were described, one consisting of paresthesia and one less common, mainly dominated by pains in the legs. Besides a clinical report and detailed case histories, there was also a discussion on paresthesia in general. The thesis comprised 34 moderate to severe, 120 mild cases of the paresthetic form, and 15 cases of the painful form of the disease. Restless leg syndrome was shown to be very common, about 5% in a so-called normal material, and it was also rather common in association with iron deficiency, sideropenia, pregnancy, and some internal medicine diseases. The Dissertation Act took place in Stockholm in May 1945, and in fact on the very V-Day, the remarkable day when the Second World War came to an end. And here you can see my father intensely concentrated when defending his thesis. And as you see, at the dissertation, you had to wear a black dress coat. My father became associate professor in 1945 at the Karolinska Institute and worked at the Serafimer Hospital in the 40s and 50s. In 1957 he became professor of neurology at the University of Uppsala. And here you can see him with the staff of the neurological clinic in the late 50s. The 2 residents are doctors Per-Olof Lundberg and Siegfried Blom. Both of them later became professors of neurology and neurophysiology. And here you can see him at the neurological ward in Uppsala. My father had many interests besides neurology: literature, chess. He was a good amateur player in his younger years, furthermore collecting stamps, sports, especially playing tennis. I have myself, so to say, inherited his interest for restless legs and headaches, and during the years I have been especially interested in the syndrome of cluster headache. Etiology and pathogenesis of restless legs are still poorly understood, but successful treatment is now available, and I am convinced that this symposium will shed further light on the syndrome that causes so much suffering among patients. Very welcome. Thank you very much.